Hi, my name is Ramkrishna Patel. I'm one of the interventional radiologists with AMI Vascular Institute, and I'm happy to get to know you guys a little today. I grew up in Delaware. I went to University of Delaware for undergrad, and went up to Jefferson for medical school, and for 6 years of training, I was up in Albany, New York at the Albany Medical Center, and straight out of training, I joined the Vascular Institute, so I'm very pleased to be here and help in this area. So I learned about vascular interventional radiology very early in my medical school training, and I'm very fortunate for that. I think it allows us to reach a wide breadth of patients and help out in many different ways, potentially avoid surgical intervention or tag along and help with things that are getting treated surgically. So I think just the breadth of treatment where we could really go from the head to the toe and find some shape, way, or form to help people out in a minimally invasive manner with very few post-procedure side effects or post-procedure pain. I think that it's certainly a great way to reach a wide breadth of patients. Some of the common procedures and interventions that we perform in interventional radiology varies from peripheral arterial disease, where we will perform arteriograms or angiograms of the blood vessels, both arteries and veins in the legs or other areas of the body, potentially to help diagnose areas of narrowing or blockages, help treat those areas by opening those areas up. We also treat cancer in the liver or other areas of the body. We could treat kidney tumors. We go in to shut down blood flow to abnormal areas or things that are abnormally enlarged, such as the prostate or uterus for fibroids. And also in the case of rectal bleeding related to hemorrhoids, we can go in to help shut down bleeding from that standpoint. Those are some of the larger procedures we do. Some of the smaller procedures that we can perform include biopsies. Sometimes vein treatments can, it's a quick 5-10 minute procedure, but it can make a world of a difference in someone's life. So from my training, both before and also since working with the group, there are some areas of practice that I particularly focus on. One of those is arterial disease, or specifically critical limb ischemia related to wounds or unrelenting pain in people's feet or lower legs. That is typically treated with arteriogram and intervention, meaning opening up some of the blockages in the blood vessels to help restore blood flow to the legs. Additionally, I specialize in men's and women's health, so I help treat enlarged prostate in a minimally invasive, non-surgical manner by shutting down blood flow to the prostate to help shrink it and help men urinate better. I also treat fibroids with embolization, or shutting down the blood flow that can help with symptoms of menstrual cramping and heavy bleeding related to periods. I also treat internal hemorrhoids with arterial embolization. Some of the common symptoms other than rectal bleeding caused by these hemorrhoids can be pain, itching, or discharge. Additionally, from my training before joining here, I also specialize in interventional oncology, so the minimally invasive treatment of cancer without exposing your whole body to the radiation or chemotherapy. So we can target areas of the tumor utilizing the blood supply or just through needle guidance directly into the tumor to help treat the cancer cells without having to expose the whole body to systemic treatments and the side effects associated with that. Recent advancements and innovations in interventional radiology that really excite me center around musculoskeletal embolization. There is continued growth in new applications of techniques that we've been using for decades, frankly, to help treat problems in different areas of the body. In the last few years, there's been significant growth in the application of embolization for musculoskeletal injuries such as tennis elbow, plantar fasciitis, osteoarthritis or arthritis of the knee, frozen shoulder, and using the ability to shut down the blood flow with microscopic particles as a way to help alleviate the pain and avoid surgery. Our practice really does a wonderful job of collaborating with our referrers and other doctors that the patients are seeing. So we have a routine protocol of sending our consult note, our procedure notes, and our recommendations with every provider that is seeing the patient. So everyone is in the loop with your care, what we spoke about, or what our plan is for the procedure. Additionally, most of us just tend to text all the docs around and just make sure that everyone's updated, so when we see you, your doctor immediately gets an information, either a note or a text from us saying, hey, this is, we saw so-and-so, and this is what our plan is for them. Let us know what you need from us. I think one of the strengths of our specialty is we work with so many different doctors that we kind of get used to getting in touch with everybody and making sure everyone's in the loop. One of the most rewarding experiences of what I do is seeing you after the procedure, usually about a month later, and to see the difference not only in your life, but in the way you walk, the way you talk, the way you just walk into the office. It almost seems like it's a completely different person. My favorite thing is the hugs that everybody wants to give us about a month or so later when they're like, oh my God, this changed my life, and I'm so grateful for that. So I think, yes, it's rewarding to see the change on the angiogram or on the pictures while we're doing the procedure, but there's nothing like the patient walking in and just looking like a different person. My advice to someone that's considering interventional radiology treatment is to go ahead and come in and give us a chat. Everything that we do starts with a consultation. So you're not going to show up for a procedure without ever having talked to the provider that's doing the procedure for you or having the information beforehand. So there's no harm in coming in for a consult. You come in, we'll talk about what you have, what procedure you might need, and or maybe you don't need anything at all and we can help get you through with some conservative treatment. But there is no harm in coming in for a chat and getting to learn a little bit more about the procedure and the options that are available to you. My approach to patient care is always a frank and open conversation. So I'm here to listen to you about what's going on and see if there's any way that I could help you with what's going on. Now, that could be anything from a small pain or an ache, or there's multiple places have told you that you might lose a toe or a foot. So a broad range of things, but whatever it is, we can talk about what's going on with you, what you need, and if there's anything I can do to help you. Hi, I'm Ramkrishna Patel. Thank you for watching, and if you have any further questions, you can reach out to us at vi-ami.com.